Hi, I'm Dr. Marc Braunstein. I'm a hematologist oncologist at the NYU Perlmutter Cancer Center in New York. So this year we're presenting a poster on comparative outcomes of younger multiple myeloma patients aged less than 50 compared to older patients. Patients who are younger than 50 with multiple myeloma represent only about 10% of all myeloma patients, so they're less well characterized. And in this study, in collaboration with the HealthTree Cure database, we aim to characterize the younger patients compared to the older multiple myeloma patients who have a median diagnosis of age 69. In our study, we found, for one thing, younger patients were more likely to go for autologous stem cell transplant, about 75% of the patients in our study. Also, they were more likely to present with skeletal or lytic lesions, and their outcomes were really impressive in terms of their median 4-year survival of upwards of 98% in our study that spanned from 2010 to 2023. And there was a mix of triplet regimens and quadruplet regimens, but their survival was very impressive. We have to understand that multiple myeloma is a diverse disease and can affect younger patients as well. And these patients need the same sort of care as our older patients in order to go through treatment, in order to support other issues that might not be the same for older patients, such as preserving fertility. So I think the implications of the study are helpful for, one, just characterizing their outcomes, but also shedding light on the fact that there are younger patients with this disease who also have special needs to manage their specific disease at their age group. Well, one reason why younger multiple myeloma patients may fare better is just because they have fewer medical conditions. They may have better preserved organ function or more bone marrow reserve. So, one implication is that we should be aggressive in treating younger multiple myeloma patients in order to prolong their lifespan as much as possible, especially in the high-risk patients who were not necessarily enriched in our study, only about 20%, which is on par with the typical incidence of high-risk myeloma. But I think for your standard risk patient who's younger, who's newly diagnosed with multiple myeloma, I think you really want to be as aggressive as possible in order to prolong their survival. I think whether we're talking about younger patients or comparing them to the standard kind of older patient over the age of 60, I think it's important to be aware that this disease is characterized by major differences between individuals, both in terms of their myeloma genetic profile, in terms of how they present, the symptoms in which they present. So it's really important to see a myeloma specialist who can kind of break apart all the important characteristics of your individual disease and create a treatment plan that's tailored for you. One thing in our study, since it spanned more than a decade, is that only about 30% or so of the patients in our group got treated with quadruplet regimens. And I think at the current state of affairs, all patients who are fit should really get a quadruplet regimen. And there's plenty of data being presented at the current ASH meeting, both for transplant eligible or transplant ineligible newly diagnosed patients, that says that quadruplet regimens really do better than our triplets. So I think that's one of the major implications.